That's sort of the direction we want to go with healthcare. And if it were up to me, we would start solving it with primary care. I think that's I don't know, this isn't like a whole long discussion on healthcare policy, but direct primary care is a phenomenal gateway to, I think, solving so many issues with healthcare. Is that, the best way, the thing that people need the most is a doctor they trust, that they choose, that they have a relationship with. Just a primary care doctor. This is very important, I think, in healthcare. We have a system already in place that's just sort of grown slowly. It's big here in Houston. I don't know how big it is around the country. But a direct primary care system means, you're a doctor and you have a subscription service, basically. $75 a month is considered the average. And so that's a cell phone bill. It's a cheap cell phone bill. And now you have total access to a doctor. It's a primary care doctor. It's not insurance. It's not catastrophic care. But it's total access to a primary care doctor. And that involves quite a bit of services that you're never paying for because you just have a monthly bill. And people really like that. It also has the effect of reducing premiums because companies will, I'm really passionate about this. That's why I'm kind of going a lot of details on this one. But so companies will actually, contract with a primary care doctor in this particular model. And then everybody's premiums go down as well. So you have to have both. But you're reducing costs massively, and you're giving people what they want, again, which is a relationship. And it's also an easy relationship. It's like, okay, I'm still sick. I've got this like weird mole on my nose, something. If I go see my doctor, is there a copay? Do I have to call my insurance company? Like, how do we set this up? I mean, it's people get very annoyed with this for good reasons. And this takes all of that out of it. And I think it's a great step forward. So, but can everybody afford $75 a month?
Well,
no, not necessarily. So this is a simple question: is just subsidize it and give them an HSA account. A health savings account is something everybody in America should have. And you can, for the people who can't afford it, can you subsidize that cost? And so again, government has a role here, but it's a light touch, and you're allowing market forces to compete because
Well, a couple things about the healthcare system. One, it's